Hey everyone, welcome back to our channel. For those of you who are new here, I'm an internal medicine trainee currently in the Wessex deanery. I came to the UK and started working in the NHS in April 2021. Today, we're diving into something super important for all aspiring doctors out there, the UK Medical Licensing Assessment or UKMLA. Whether you're a medical student in the UK or an international medical graduate looking to practice in the UK, this video is for you. In June 2015, the General Medical Council, or GMC, announced that all doctors who wish to work in the UK will have to sit a standard test to determine whether they are fit to practice. This test is known as the United Kingdom Medical Licensing Assessment, or UKMLA. This ensures that all doctors meet a common threshold for safe medical practice in the UK. Just like the United States Medical Licensing Examination, or USMLE, which is required for medical licensure in the US, the UKMLA applies to both UK medical students and international medical graduates. So, when do you need to take the MLA? For all medical students graduating from UK universities from the academic year 2024-25 onwards, passing the MLA is mandatory as part of their degree before they can join the medical register. And for international doctors starting in 2024, the MLA will replace the PLAB exam. The MLA is a two-part test. The first part is the Applied Knowledge Test, or AKT, which is a written assessment of applied clinical knowledge. The second part is the Clinical and Professional Skills Assessment, or CPSA, which is a performance-based assessment of clinical and professional skills, knowledge, and behaviors. The MLA is set and delivered by UK medical schools for their students and by the GMC for international medical graduates. Let's dive deeper into each part. The AKT is an on-screen, multiple-choice exam that tests your application of medical knowledge to different scenarios. For UK medical students, this will be run by their medical schools. For international candidates, the GMC will set the AKT, and it will run 4 times a year at various locations worldwide. Next, we have the CPSA, which is an assessment of clinical and professional skills. UK medical schools will administer this for their students, often through formats like objective, structured clinical examinations, or OSCs. It's international medical graduates will take a similar assessment at the GMC's Clinical Assessment Centre in Manchester. The CPSA involves scenarios that reflect real-life settings, such as mock consultations or acute ward situations. This ensures that you can demonstrate the practical skills needed for safe medical practice. Now let's talk about the MLA content map. This map outlines everything you need to know and be able to do to pass the MLA. It's organized into 6 domains: areas of clinical practice, areas of professional knowledge, clinical and professional capabilities, practical skills and procedures, patient presentations, and conditions. The areas of clinical practice domain include specialties, body systems, and patient types. The areas of professional knowledge covers clinical and scientific knowledge like biomedical sciences and medical ethics. Clinical and professional capabilities focuses on abilities required for patient care, such as managing risk and safeguarding vulnerable patients. The practical skills and procedures domain lists the essential skills you need to perform safely, while patient presentations covers typical signs and symptoms seen by doctors. Lastly, the conditions domain includes common diseases and diagnoses you'll encounter. For UK medical students, passing the MLA will be part of your medical degree requirements starting in the 2024-25 academic year. You'll take both the AKT and CPSA at your medical school on dates they choose. For international medical graduates, the MLA will replace the PLAB from 2024. You'll take the AKT and then the CPSA at the GMC's Assessment Centre in Manchester. It's also important to note that the MLA won't change the English language requirements for registration. International graduates will still need to prove their proficiency in English to practice safely in the UK. Until the MLA is fully introduced in 2024, international medical graduates can still apply for the PLAB test. If you've already started the PLAB process, there are specific guidelines on how it will transition to the MLA. That's a wrap for today's video on the UKMLA. If you're preparing for this exam, make sure to familiarize yourself with the MLA content map. It's your roadmap to success. If you found this information helpful, give us a thumbs up, subscribe to our channel, and hit that notification bell so you don't miss any future updates. Thanks for watching. Stay tuned for more tips and guides on your medical journey. See you next time.